Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh and a very good afternoon. Today I'm presenting a research project entitled The Effectiveness of Orthokeratology in Reducing Axial Length in Myopic Children Living in Kuala Lumpur. As an introduction, myopia is a condition where a person experiences blurred vision at distance but clear vision at near. It is the most common ophthalmic condition in the world, with an estimated 22.9% of the world population being affected. It is often regarded as a benign ocular disorder because vision of myopia person can easily be corrected using glasses, contact lenses, and refractive surgery. This is a slide that shows global myopia prevalence among young adolescents, and as you can see, the highest prevalence is around East Asian regions. As you can see, in Singapore about 74%, in South Korea 97%, in Hong Kong about 80%, and in Japan around 60%. We also know that myopia prevalence is increasing in every decade. It is expected to reach 52% by 2050, which means that one in every 2% will become myopic by 2050. Our main concern about myopia is that myopia can develop into high myopia. High myopia is associated with serious ocular diseases such as glaucoma, retinal detachment, maculopathy that may cause permanent visual impairment. The prevalence of high myopia is also increasing around the world, and it is expected to reach around 10% by 2050. Therefore, controlling myopia progression is crucial. There has been a lot of myopia intervention studies conducted around the world using different kinds of intervention. And one of the effective intervention, as you can see in this table, is the orthokeratology technique. The orthokeratology is a technique that uses specially designed rigid gas-permeable contact lens to temporarily reshape the cornea, reduce refractive error, and retard myopia progression. The contact lens flattens the central cornea, steepens the mid-periphery to reduce refractive error, and improves vision. Orthokeratology has been proven to be successful in retarding myopia progression in children in many populations around the world. The retardation of myopia progression is monitored by measuring refraction and axial length elongation before and after intervention. Nevertheless, there is no reported data available in the literature from the Malaysian children. Therefore, the aim of this study is to investigate the changes in axial length in local myopic children undergoing orthokeratology treatment for 12 months. The results were compared with spectacle-wearing children. This study focused on Chinese myopic children due to their high prevalence of myopia compared to other races in Malaysia. Methodology: Chinese myopic children living in Kuala Lumpur area were invited to participate in this study. The inclusion criteria was age range between 7 to 9 years old, myopia of less than -5 diopter, astigmatism of less or equal to -150 diopter, best corrected visual acuity of 6/6 in each eye with no history of ocular or systemic diseases, and never undergoing any myopia treatment prior to this study. Cycloplegic refraction, best corrected VA, corneal topography, and axial length were monitored throughout the study, and the results were analyzed using t-test and ANOVA. Results: 70 myopic Chinese children participated in this study. 35 of them were males and 35 were females. Mean age was around 8 years old. 45 of them were fitted with Orthoke lens, and another 25 were fitted with single vision spectacles. The mean refraction between both groups at baseline were -3, and there were no significant difference in terms of refraction and axial length at baseline between both groups. Table 1 shows measurements at baseline and 12 months in both groups. As you can see, there are significant differences in spherical equivalent refraction, in best corrected VA, axial length, and corneal curvature at baseline and at 12 months in Orthoke groups, but there were only significant difference in spherical refraction and axial length measurements in single vision group. And table 2 showed measurements at 12 months where we compared the results of spherical refraction, best corrected VA, and axial length and corneal curvature between both groups, and the results showed significant difference in all measurements except best corrected VA. Discussion and conclusion. The results of this study showed significant reduction in spherical equivalent and axial length after wearing orthoke lens for 12 months, which concurred with previous study. In this study, axial length elongation was reduced by around 44% in orthoke lens wearers compared to single vision spectacles, and the results were similar to earlier findings in Hong Kong children. No significant adverse events were noted due to contact lens wear throughout this study. As a conclusion, this study concludes that orthoke lens is effective in reducing axial length without compromising visual functions. Patients' compliance is the key factor for successful and safe orthokeratology lens wear in children. Orthokeratology should be considered more by local optometrists when managing myopic children. We would like to acknowledge the parents and children who participated in this study and Manicon Limited Japan for funding the whole project. Thank you very much for your attention.